In December of 2019, a novel coronavirus, SARS-CoV-2, emerged, resulting in the COVID-19 pandemic. Given the enormous number of cases, over 10 million cases in the United States to date, there are many survivors who have suffered from a range of cardiopulmonary complications from this disease. It's now well recognized that COVID-19 results in significant cardiovascular morbidity and mortality. Cardiovascular complications include myocardial injury, reported to occur in 20 to 30% of patients hospitalized with COVID-19. This is also associated with a worse prognosis and a high mortality rate of approximately 50 to 60%. Mechanisms of injury include myocarditis and coronary vasculitis. Myocarditis may be due to direct viral infection rather than cytokine storm. Coronary vasculitis may be due to viral effects on the endothelium, demand ischemia, plaque destabilization, and right ventricular failure. Right ventricular failure deserves special attention. The right ventricle is particularly vulnerable to injury or failure caused by hypoxemic pulmonary vasoconstriction. Patients at risk include those with underlying viral pneumonia, acute lung injury, and acute respiratory distress syndrome, as well as those with known increased risk of pulmonary microthromby or thromboembolic disease. These injuries likely predispose patients to cardiac arrhythmias, which probably contribute to the morbidity and mortality seen in this disease. Further, patients with underlying cardiovascular disease have an increased risk of morbidity and mortality due to COVID-19, perhaps due to the additional damage in an already compromised heart. Testing modalities that can detect cardiovascular complications include troponin levels, ECG analysis, echocardiogram, and cardiac MRI in those with myocardial injury. Currently, treatment is directed by the standards of care for these disease states in non-COVID-19 patients. The data regarding long-term outcomes of these complications are currently limited. Similar to patients with severe acute respiratory distress syndrome, or ARDS, patients with severe COVID-19 pneumonia may have ongoing respiratory dysfunction, with restrictive physiology and reductions in the diffusion capacity after the acute illness. Obstructive physiologic abnormalities have also been reported. Radiographic imaging in patients who have recovered from severe COVID-19 pneumonia has revealed residual ground glass abnormalities seen in acute COVID-19 pneumonia or consolidative abnormalities. Some of these abnormalities likely represent organizing pneumonia. Radiographic imaging has also revealed interstitial and fibrotic changes, which likely account for ongoing restrictive physiologic and/or gas exchange abnormalities. Bronchiolar abnormalities, bronchial wall thickening, and bronchiectasis appear to account for the ongoing obstruction noted in some patients. In patients with COVID-19, extensive microthrombi in the pulmonary vasculature have been identified, and patients with COVID-19 appear to be at increased risk for overt pulmonary emboli. The hypercoagulation phenomenon in these patients can lead to persistent pulmonary hypertension with ongoing hypoxemia, diffusion defects, and right ventricular strain, and may ultimately lead to chronic thromboembolic disease. Like cardiac complications, the long-term outcomes for these pulmonary complications is not known at this time. Of particular concern is whether those with underlying moderate fibrosis will develop a progressive fibrotic phenotype. Currently, treatment is directed to the underlying cause. For those with progressive pulmonary fibrosis, it has been hypothesized that antifibrotic therapy may be of benefit, and additional studies are warranted. Similar to underlying cardiac disease, underlying pulmonary disease increases the risk of increased morbidity and mortality from COVID-19. These conditions include COPD and likely severe asthma, cystic fibrosis, pulmonary fibrosis, and active smoking. In summary, patients with ongoing breathlessness and/or oxygen requirements need a thorough multidisciplinary approach to determine the underlying etiology of these symptoms.